Hello, and welcome to Southwest Healthcare, Palmdale Regional Medical Center. My name is Trenton Doss, and I'm the Inpatient Therapy Services Supervisor. You are embarking on a journey to receive a lower extremity total joint replacement at Southwest Healthcare, Palmdale Regional Medical Center. This video will help you understand what to expect as you go through the surgical process and what to expect when you get back home. In the preoperative unit, your nurse will be collecting important information and starting an IV to prepare you for surgery. Your care partner may join you during this process. With your permission, your care partner can receive your ID number so that he or she is able to track your progress throughout your surgical stay. The monitor is located in the surgery waiting room. You will see your care partner once you are discharged from the hospital or are transferred to a patient room. Our goal is to discharge you home on the same day of the surgery. You will only be admitted to one of our private patient rooms for a longer stay in the hospital if it's medically necessary. You should have already discussed the use of pain medication with your surgeon. You will be receiving pain medication after surgery, which is intended to reduce your pain. The pain medication is meant to decrease your pain to a tolerable level so that you're able to participate with physical therapy and start walking in slow increments in the days after your surgery. Your surgeon will do an excellent job during the surgical procedure to get you on the road to recovery. But the rest is up to you. You will be expected to put in the work that it will require to get back to a healthy level of physical activity. After surgery, you will be in the recovery area of the surgical unit. For the first 2 hours, you will not be able to get out of bed. The anesthesia must wear off to a certain level before any physical activity begins. You will be given a bedpan or a urinal to use if needed. You also will be treated for any nausea or vomiting or pain that you are experiencing. In phase 2, a physical therapist will begin working with you to get you moving in a safe and methodical way. The physical therapist will sit you up on the edge of the bed and have you move your leg. You won't be asked to get out of bed until you can dangle and lift and hold your leg up for a short amount of time. It's about 15 seconds. You will also be given an incentive spirometer during phase 2. This device should be used 10 times every hour for the next 5 days. You will release your breath and then inhale on the mouthpiece of the spirometer in a slow and steady manner. Your nurse will give you more specific instructions after surgery. When you are ready to be discharged, you will be using a front-wheel walker to transfer from a wheelchair into your vehicle. You will continue to use this front-wheel walker at home. This walker provides stability and prevents falls. You will also be attending regular physical therapy appointments in the weeks following surgery, and your physical therapist will inform you when you can stop using the walker and transition to using a cane. On the day of surgery, once you are home, it's okay to relax. Please know that it will take more time for the anesthesia from surgery to completely wear off. Please don't move a lot or walk a lot on the day of your surgery. You can move a little bit as you lay in bed, or you can sit in a chair and do ankle pumps to introduce your limbs to the idea of beginning physical activity. The day following surgery, please get up and move at least once an hour during the hours that you are awake. Walk very short distances, for example, from your bed to your bedroom doorway, or from your chair to a kitchen or a restroom. Moving for short distances once every hour is a very good start to getting your lungs functioning, your bowels moving, and to help aid in the healing of your total joint surgery. Since you will be taking pain medication, this may cause constipation, so we recommend taking a stool softener in the morning and in the evening. We also recommend that you take a laxative once a day. You shouldn't let more than 3 days go by without having a bowel movement. If this happens, tell your doctor immediately. It's very important that your bowel movements become regular and stay regular. I mentioned earlier that the expectation is for you to be discharged home on the same day as your surgery. If for a medical reason you are admitted to one of our private patient rooms on one of our inpatient units, you will be expected to dangle your leg while sitting on the edge of your bed. You will also be expected to get out of bed and use a toilet or a commode. You will get up and sit in a bedside chair for breakfast, and a physical therapist will visit you to start the physical therapy process. You will also have an SCD, a sequential compression device, on both of your lower legs anytime you are in your bed and during sleeping hours. This device expands and contracts and promotes circulation to reduce the risk of blood clots. We want your lower extremity surgery to give you a better level of physical activity that perhaps you haven't experienced in a long time. We will do our best to help you along in your journey. As I mentioned earlier, the rest is up to you. You will experience some pain along the way, but it is all part of the healing process. Keep going, and soon you will be back to doing the things you love. And thank you for trusting us with your care.